So, uh,
Hi, Dr. Fatma. I have something to add among this all in celiac. If you guys give me just 1 or 2 minutes.
your
Sir, go
feedback
ahead.
is very valuable. Go ahead.
Yes.
Overall, case was I started actually in the mid of history. I am on duty now. Fine, history was fine, and explanation you guys are doing is far beyond what they are asking. It's too much depth. In too much depth, we are going
Yes,
just the
yes,
basic 4 or 5
yes.
things. TTG level, if Ig is deficient, IgG with related TTG and anti-endomysial. Okay, and if still less than 10 times, then to go with the biopsy. And there is one indication also for the parental wish. If they wanna ask you or requesting you, you can go for biopsy. These are 4 and 5 things. Do not go too much deep as showing in this S1 because this is for gastroenterology.
You're right. You're right.
Yeah, because I had a celiac case in first exam. Okay, so these 4 or 5 things are better. If you go in depth, you will forget all of these things.
Yes, we have many things to discuss, and we have all have exam actually after 1 month. So better to focus on specific
6, 7
things.
complications. Yeah, 6, 7 because we are not
Yeah.
going for theory exams. Clinical,
Yes,
they
we
have maximum time in history to dig you more about the depth of some disease. Others
How to
like
differentiate,
extended or
yes.
development, they are very few. 3 minutes, among 3 minutes, you will explain them history examination. Also, they have only 1.5 minutes. But history, they may have 9 minutes, so they can dig you more about that. But disease, they will ask you maybe definition. One thing is important, that's called types of celiac disease. Nobody discussed that one. I was waiting that somebody maybe. There are 4 or 5 types of celiac disease. One is classical, one is non-classical, or can I call as silent. There is one is subclinical, then there is one is potential, and one is refractory. Okay, so there are a little bit difference. Like classical present with all what we have discussed. Okay, non-classical or silent present with the milder symptoms. But if you go for the investigations, you will be having this positive all. Most of the investigations. Then comes subclinical. Subclinical patient will be having only few or milder symptoms. But they will come across very late, came to know about his condition very late when symptoms will get worse. But initially you cannot catch it up. Potential is the one, it is like mild symptoms, but biopsy if you'll do, it will be non-conclusive of biopsy report, what we have discussed. This is 4 types of villus atrophy and crypt hyperplasia, lymphocyte infiltration, and plasma cell infiltrates. So these 4 findings of the biopsy, you will not find it in potential case. Fine. So, and they will not respond also to gluten-free challenge also. So if you start with gluten-free challenge, they will not respond to that. And 5th is refractory, that normally they are not responding to gluten-free challenge. And if they will do initially, later on, it will be resistant. And they will develop small bowel malignancy, most commonly small bowel lymphoma, in case of refractory celiac disease. So these are just 4 or 5 points I would like to add, because they may
And I want to add,
yes,
and I want to add one more thing. The figure of 10 is very important, as 10% of the celiac disease, they have IgA deficient. So we have to go for IgG antibodies. And if the figure of 10 is more than 10 times the normal value of IgA, you will confirm and won't do the biopsy. I think these points are important in the clinical exam.
Yes.
Not from where you will take the biopsy. No, he's not going to ask.
As long as you will go in more depth and discuss here or like that, go clinical for clinical exams. Because celiac is a very important topic, main things you must know. But in depth, it's inheritance also is autosomal dominant or recessive also. Because they may ask you how there is something genetic component is there. No? So it could be autosomal dominant as well as recessive. So major things just need to know. Minor, the major things if you do, that will be sufficient.
Yeah, I think we covered most of the things. And,
almost everything.
Everything. We can move to the next, I think.
Okay.
Thank you.
They are asking these types, or you just told for us for the.
No, there are types, 5 types of these. So
Just-
that's
But
why
they are
now-
not asking. They are not asking in 1 minute or 2 minutes. They will just ask for diagnosis, investigation, what Dr. Itrat has told, and the management. That's very superficial. They will not go in depth for the
Not
types
going
even.
to.
They just
But you know now
investigation.
why I'm asking, because they have 9 minutes. History is the lengthy station maximum for Viva in all among all stations, because
Yeah,
they have
history,
9
yeah.
minutes to ask. So that's why they may dig you superficially about different things. Okay, so
Yeah.
major diagnostic criteria, major complications, these things everybody must know. Inheritance, they may ask you. It has both sometimes.
What are the
autosomal
complications?
dominant.
What are the complications?
Yeah, it has like if you go, there are many starting from, they will be having this chronic anemia.
And-
Any disease, chronic anemia, they will present, or microcytic hypochromic anemia, bone pain or bone deformities. Then
Divided into intestinal and extraintestinal.
intestinal,
Better it is,
extraintestinal, yes, this is
yeah, better to remember in Crohn's, inflammatory bowel, or celiac. Divided into intestinal and extraintestinal. So extraintestinal is all related to this nutrition, vitamin A, D, K, the minerals, calcium, like iron, and then all these vitamin B, like this stomatitis and all. It
there
can
are
lead to
certain
neuropathy.
symptoms, certain complications. What you are showing is these are symptoms, or they present with that. But
Yes.
there are complications that are a bit different from this.
Yes. So lymphoma specific, you can remember like this.
Yeah.
Then you can go specifically like this. Yeah.
Yes, this is okay. This is fine.
Yes.
Dr. Itrat, regarding the history, we have to define ideally the which patient has ideally celiac can cause this protein, fat, or lactose, means carbohydrate intolerance. Have we identified which specific problem he has at the moment? Already he has primary celiac, but he is in malnutrition. So we have to identify.
We have to dig it out something about differential. Na? Remember, in videos or in clinical short or in history, you should prepare 3 differentials what you could defend during the exam. Minimum 3 differentials in each everything. If you could not defend yourself, because you can present now, what could be the differential of celiac? Firstly, if you go like that, what is
Giardiasis,
the differential?
celiac giardiasis, protein
Okay,
losing
what else?
enteropathy. Cow milk, although less likely 4 year, but it could be. And
So how will you defend your celiac in this one? How you will differentiate? Like this is giardiasis, but
abdominal distension, diarrhea.
and there will be no. There could be you see, celiac is like being differentiated on the basis of symptoms as well as on the basis of intestinal biopsy. If they will ask you, how will you differentiate on the basis of intestinal biopsy? Then what would be your differential?
Then there are different lists, tropical sprue, giardiasis, and intestinal TB could be this like ideally less likely, but it could be. And there protein, cow milk protein allergy. All then this 3-4 I'm memorizing the Nelson.
Malabsorptive, but not with the typical biopsy picture. I will tell you there are 4 common I have mentioned earlier. We wrote it in our book previously. So one is tropical sprue, you said, very good. One is HIV enteropathy that present with the same intestinal biopsy finding. Then there is something called as eosinophilic gastroenteritis. So these are the things if you go, but this much depth they will not go. But as I said, they have maximum time. So the 4 common presentation of biopsy finding, that one is sufficient. But if they ask you on the basis of malabsorptive symptom differential or on the basis of intestinal biopsy finding, these are you must know 2 or 3 at least.
The next thing I want to ask, have we in the short case of loose stool diarrhea, malabsorption, we have to calculate the total calories he has taken in 24 hours?
Or this time, no. Firstly, this time is totally verbal exam. Okay, and they're not gonna ask you or expecting you that you will calculate the calories in exam. Not at all. Be very superficial, because the examiner, whatever they're coming to you, nobody will be, if your CVS station or CVS case, they will not keep any examiner from cardiology. If you have a neurology case, they will not keep any neurologist, because they know neurologist will ask in depth. So they are giving general or common pediatricians. So this thing they informed us in our previous exam. So be very superficial. Your knowledge is more than the examiner. So go in just a superficial way. What they ask, answer only that one. Don't try to be over smart with them. Simple answer, simple question, simple answer. And the common
Yes.
things are
Don't say
common. Just remember.
yes. Don't say anaphylaxis and all.
If they ask you
Common
more,
status
you
like
can
this.
answer.
Yes, but not expected.
Because
Okay.
practically here you are sitting, you have a lot of time. When you go and examiner, they will not give you 5 seconds extra. You finish, they will stop. They will move next because they have 20, 30 candidates to go through. So you cannot do all this what we are trying to discuss here.
Yeah,
Be
we are discussing
superficial.
it. Yes. They have to conduct the exam every 6 months. So you can imagine how much they are
6
bored of.
months? More earlier. Too much. Every 3
More
months,
earlier,
4
in fact, yes. 3 months. So how much they are bored of, you can imagine. So they won't go into deep. Anyway, so shall we move, Dr.